So let's get down to the main reason for this video. I wanted to take the time to explain a little bit about, well, I wouldn't say I wanted to, but I thought I should, about why it's been so long since I posted a video. I've frankly just been having a lot of problems with my health over the last almost year. And although I'm normally a very private person and don't necessarily like to discuss health problems and other personal stuff openly with others, and even my own close friends and family, I thought, I don't know, getting it all out might be therapeutic, so it was nothing. Anyway, this all started last November, not long after I posted my last video, and frankly not long after my last birthday. My doctors are great, where I don't actually have to call and schedule an appointment. You can do walk-ins, because I actually have really bad bone anxiety. It's weird, whatever. So I originally went there actually for, because I had an eye infection. But while there, they were like, hey, you're kind of due for a checkup, annual physical, whatever, you want to get that taken care of while you're here. I'm like, sure. And I mean, that went well, but they also brought up that I needed a woman exam. It reminded me that I needed a woman exam, and I was due for that, so I scheduled it while I was there. That's where the problem started, so to speak. Well, aside from the eye infection, I had the pap smear, and when they do like tests and stuff, they post the results you get an email and they post it on the online patient portal thing that they use. So I got an email afterwards when the test results came from that, like even before the doctor saw it, and the result was not good. It was this. I didn't even know what that meant. I had to look it up, because at the time I'm looking at that and I'm like, that's not good, is it? And then I looked it up, I'm like, that's definitely not good. And I'm like, yeah. So I had a follow-up appointment with the gynecologist to discuss the results. And about this time also I started having lower back pain, but we'll get into that later. And so the doctor explained pretty much what it meant, pretty much what I looked up and read about, but more detail. But the thing you have to know about me is, okay, over the years, every so often something comes up, and then I get this little voice in the back of my head telling me something, and I'm just like, no, of course that's not right. Oh no, it's not that bad, whatever. I doubt that little voice, only to find out that it was right on. Especially the previous year before that, dealing with this friend of mine that I no longer speak to. Every so often something would happen and this little voice would tell me something. I'm not going to go into details, but yeah, when dealing with him, something, and I'd be like, no, of course that's not it, right? I only to find out, yeah, it was. So yeah, so many times that little voice in the back of my head was right. So even though almost immediately first thing at the beginning of this appointment, the doctor's like, don't worry, this doesn't mean you have cancer, don't think you have cancer. Little voice in the back of my head for the next 2 months was like, what if this means I have cervical cancer? Because that's what this pap smear is screening for, essentially. But so anyway, after a result like that, and he explained this, it means having the, I always pick up the name of the procedure done, but yeah, put it here. Essentially what it means is they go and get a closer look at your cervix to see what it looks like, if you have any sort of lesions or whatever things to be concerned about on there. It's not a very comfortable experience. Essentially, they prop your legs up on, similar to when you have a pap smear and stuff, and open you up and then stick a camera right there, not in you, mind you, but in front of you, and then zoom in, and then you can see everything, and I mean everything, on like a computer monitor, so that the doctor can see what's going on. And depending on what he sees, he might take a sample to do a biopsy, which is what he had to do. yes, I had to wait till, by this point, keep in mind, this is in December, this is near like all the holidays and stuff, so I'm dealing with all, I'm planning all the holidays. I always do, like plan all the meals and things like that for like Thanksgiving and Christmas and stuff, and my family, and plus the back pain, yeah. So when I go in for the follow-up appointment to find out the results, it's literally the day after Christmas. And okay, picture yourself this. You go in the doctor's office, you get called back, taken to the little room, you wait for the doctor, and the woman who brings you back forgets to close the door though. And then you can hear the doctor talking, like, and little bits of what he's saying, and he sounds really angry, like he's really, really upset about something. And you hear just enough, a little bit, so you make out a little bit to know that, and to realize, wait, he's talking about you. Something's wrong. Because that's what happened. And after like a minute of that, the woman comes back realizing, oh, she should have closed the door, and she closes it. And I'm sitting there left in suspense, like, what happened to make him so upset? Because am I getting bad news? And I'm like, so he comes in, and I find out why he was so angry. I can laugh about this now, but at the time it was like, are you kidding me? When he took the sample for the biopsy and sent it to the lab, they lost it before they could test it. So they had no results to give me because of this. And he was so angry that they could actually lose a sample like that. Like, my doctor's been in practice for decades, and not once has this ever happened before in his experience. And he was talking about how he's going to send like an angry letter to them and everything. So he meant having to redo that all again, and then send samples to a different lab, of course, and then come back in again. And so, yeah, repeating that a second time. Nice, but everything it worked out the second time, though. The other lab didn't lose it, and we had the results. And good news, I did have a lesion, or whatever they call it, I forget the name, but it was considered low risk, which is good. Although the way they explained it to me was that they can start off lower risk, but then it eventually progresses to medium risk, and then to high risk, and then eventually the cancer. But he said that it would take like 10 years before it gets to that point. So we had plenty of time to figure out what to do. Great. So I had two choices. One, pretty much ignore it, for a year, and then basically repeat everything and check to see if it's progressed or not. Because the thing is, in less than half of the women who have the low risk abnormal cells, whatever, they go away on their own, and then they don't have to do anything. The rest of the time, though, it does progress. So the other option was to have what's called a LEAP procedure, where it's pretty much surgery to go in and, remove it, basically. Remove the abnormal cells. I'm not going to go into further details on that. So you can look it up yourself if you want to know the details. And so he recommended I have a consultation with it, because my doctor doesn't do LEAP procedures anymore. He refers people to another doctor to do that. So he recommended I have the consultation with the other doctor to do that. But even before the appointment with the other doctor, to figure that out, I already knew what I was going to do, because I was not going to spend the whole year worrying and waiting to see whether it progressed or not. Because that's how I am. I'm going to overthink things. So I went ahead and had the procedure done, and near the end of May. So that was taken care of, and we're just getting started. Okay, so remember the back pain that started, last November or so? Yeah, and so I didn't pay much attention to that, thinking maybe I just need to take it a little easier because of everything going on, holidays and stuff, and so I started frankly slacking on my workouts a bit. Like, yeah, so by the beginning of January, I wanted to get back into a regular routine, you know, but slowly, of course, you know, actually starting to work out regularly, watching what I eat a little bit, well, returning to normal eating basically, and stuff. So for the first couple of weeks of January, yeah, I mean, things seem to be doing pretty well. My back pain had seemed to have gotten better, but I was a little surprised because I actually lost a bunch of weight during the first 2 weeks, which I shouldn't have in theory, you know, and it did concern me, but I kind of put that in the back of my mind and we're going to hold off on that for now. Mid-January, yeah, like I said, the back pain. I woke up one morning and I could not get up out of bed because I was in too much pain. Just it seemed like all over, including the back, hip, shoulder, knee, my hand. It was weird, like everywhere. I go to the doctor, and I remember, walk-in appointment, and I remember telling them at the front desk, you know, what's wrong, and I'm holding back tears because I'm just like, my whole body hurts, and I don't know why. So more specifically, my lower back, especially on the right side, my right hip, upper leg region, essentially my butt, but I'm going to go with hip, my right knee, I thought was right foot, turns out it's actually my heel, but the pain kind of radiated towards, like, throughout the side of my foot, so I thought that, you know, it was the foot. And then my left, upper back around the shoulder blades, as well as my right shoulder, and then my left hand. Although the doctor was able to tell me right away that it was what was going on with my hand. I keep forgetting the name of it. I'm going to put it down here. But essentially, it's the tendons in the thumb, that's where it was being affected and stuff like that. And then the pain radiated to the back of my hand, palm, and down my wrist a bit. And well, I said that it was caused by actually holding your phone too much. So that actually made me feel a little bit better to know what caused that and what I can do to prevent it in the future and stuff. So that was actually a little bit of a relief in a way, but what was going on with everything else. So for the risk, it was referral to this place called the Hanger Clinic, where they do so to get like a risk splint thing, you know, like it puts pressure on the wrist, which helps relieve the pain, immobilizes the thumb so that the tendons can, you know, rest and get better. But it took like over 2 weeks before I got an appointment for that. So in the meantime, having to try to be careful with it. Ice and ibuprofen basically. For everything else, I was referred to physical therapy. I didn't start that until like mid-February, so in the meantime it was prescription painkillers. Yes. In the meantime, while we're waiting for that, though, my kids and I went to the FanCon thing that our local library does every year, and my daughter entered the costume contest for her Cinderella costume that I made for her last October. So I started physical therapy, like I said, about mid-February, and actually my last day was July 1st exactly. The only thing was, it wasn't because, you know, it was all better, but because my insurance would cover it after that. Yeah. But it's okay, because they designed like a home workout for me to do to continue getting better. Physical therapy was difficult, okay, because I mean, it seemed like every so often, just when I thought things were doing better, like I was feeling better, I was being able to do more, then suddenly things seemed to get worse. Or not worse than before, but just really bad. And I came to realize when talking with them and stuff that those were just off days, basically, you know, that it happens. But as time wore on, the off days were spaced further apart. Like I would go longer with having good days and stuff until now it's pretty much all good days for the most part. I mean, I still limp slightly because of the hip thing, but for the most part, with that at least, I'm doing so much better. Now let's take a break from this to talk about something a little bit more Pleasant. My daughter and I last March went to an event celebrating downtown Mesa that featured, among other things, face painting, Ferris wheel, and a petting zoo. Yay!
Just trying to get the stuff.
That's out of the way. Let's talk about the other problems. I'm trying to remember. March. I think, was it near the end of March, was it? I noticed something strange with my feet. They were feeling a little funny, but I didn't really pay too much mind to that, because I was busy with other stuff and whatnot. Until one day, so my son and I go to the library every week for this Game On thing that they do for the teens, and he loves that. So while we're waiting for that event to start one day, and sometimes when I'm waiting, like standing around, I'll just start looking down at my feet for some reason. I don't know why. And I look at them and I'm like thinking, I thought these shoes were more flattering. I seem to remember these shoes being more flattering than this. What's going on? And I'm just looking down at them, trying to figure out what's going on with the shoes. Suddenly I'm like, oh, it's not the shoes. My feet are swollen. I developed edema in my feet, ankles, and lower calves. Swelling, basically. And I had no idea why. So I go to the doctor, and he gives me water pills, diuretics, or whatever to help to flush out the extra fluids, and recommending putting my feet up and watching sodium intake. And, it helps, but the thing is, left side was a little bigger than the right. So as a precaution, he actually ordered an ultrasound on my legs to make sure I didn't have any blood clots, which was kind of a scary thought, but in the end, no blood clots, and the swelling went down, and it's like, still not really sure what's going on with that, right? Oh yeah, and during that time I also wound up having an ear infection, but it was dealt with about the same time, so hey. Then about mid-April, one afternoon while I'm working, I realized I'm having some strange pain right here, right? It starts out dull, but whenever I take a deep breath, it would be really sharp, and like, this is not normal. I'm thinking it's chest pains, but figuring it's probably not my heart because, it's over there, but this is probably something I should look into. So that evening I went to my doctor, again, walk-in appointments, yay, to figure out what's going on. Like I said, I'm thinking that right about here, I thought that counted as a chest. They said that actually it's considered upper abdominal area, so whatever. They did check my heart just to be on the safe side, and ordered a ultrasound to look at basically all the abdominal organs to figure out what's going on. But I was told that if I was still experiencing that level of pain with the sharpness and stuff, by the next morning I should go to the emergency room, which is what I did. But in the end it was like, okay, it's not life-threatening, you're good to go. Yeah, so I had the ultrasound. Only everything turned out fine on the ultrasound except for one thing, and this really, really surprised me. Apparently my liver's too big, and when I looked up information about that, and basically they were afraid that I had some sort of liver disease or something like that. But if you look up, like, for example, the risk factors for that, what puts you at higher risk, I don't meet any of them. Excessive alcohol use, not me, I don't drink, or smoking, or drug, or smoking. I don't smoke. I never liked the smell of smoke. I never liked the smell of cigarette smoke. It's never been a thing. Being like overweight or whatever, I'm not overweight. In fact, I remember I lost a significant amount relatively quickly last January. So besides, and I was actually worried about that, but I've never been like significantly overweight for that. The sun's coming out. Anyway, one thing that came up was genetics, and it was like genetics, and it's like, is that something in my family? I've never even heard of that, so I don't know. It was weird to hear this, but whatever. So that, and actually I had some other symptoms that I didn't really go into much including lower abdominal pain actually and stuff, and there was little weight loss, like I said, in January. So I got referred to a specialist in gastroenterology and hepatology, and started going to them in early May. The doctor there is fantastic and does not let the grass grow under her feet, that's for sure. I mean, got immediately into all these different tests and things like that. I mean, almost immediately realized I actually had an ulcer in my chest, for example, that needed to be treated. So she wrote me a prescription for that right away, and now it's fine. I didn't realize it. I had noticed, and I know I haven't said anything about this until now, but when I laughed really hard, I had this weird pain right there. But I didn't think too much of it, and I know I should have, but yeah, I had an ulcer, so there was that, but then there were other things going on too. So arranged for all these different blood tests and things, as well as another abdominal ultrasound, just because she likes to do her own tests, as well as a CT scan. Recommended I take iron supplements because one, the blood test showed that apparently I wasn't getting enough iron, probably because of other issues I was going through, the problems I was having. And ordered colonoscopy. I am not going to go into detail on what that is. Just know that it was my first time ever having that. I'm actually young enough that to have not started having to have those regularly. And I was really nervous about it, but the people there were really, really nice, and a very good friend of mine picked me up from it afterwards. Thanks again, Jana. Thank you. And prior to the colonoscopy, though, my daughter actually went to Michigan to spend time with some of our family that she hasn't seen in like 12 years, and it was her first time flying an airplane at all, and she was doing it on her own. Of course, I went with her to the airport, of course, and so she's been gone for the last couple of months. So, and I miss her. So after all the different tests and the colonoscopy, finally figured out at least what's wrong with some of the stuff. I mean, I still I'm not sure about the liver thing, but we had a diagnosis, ulcerative colitis. Yeah. And I recently had an annual physical, and everything is actually looking pretty good as far as that goes, aside from the fact that I had a sinus infection recently, and yeah, the surprising thing is they said that my cholesterol was getting kind of high, or relatively so. I'm still confused about how that happened, but they recommended I take like a supplement to help with that instead. So at least if they didn't give me another medication to take or anything, so I think that's a good sign. And yeah, that's pretty much everything. And believe it or not, I did actually try to make this short. So yeah, things are actually doing better now. I have more energy, I'm able to do more now, so you should probably see more videos from me coming soon, including, for example, my daughter and I need to start planning for costume in October. We're brainstorming ideas right now. Yeah, well, trying to. I mean, she is still in Michigan, so, well, anyway, if you actually made it this far into the video, thank you so much for watching to the end, and have a nice day. Bye!